Okay, welcome everyone. So now we are going to look at the topic that is hepatic encephalopathy. So as the word indicates, hepatic and encephalopathy means the disease or the affected brain because of hepatic involvement or because of liver dysfunction. Hepatic encephalopathy is neuropsychiatric syndrome characterized by hepatic insufficiency, and it represents a reversible decrease of neurological function. It is reversible and it is decreased function of neurological dysfunction, and it is disorder of metabolism which is caused by severe decompensation of liver disease. When liver is decompensated, then hepatic neuropsychiatric involvement occurs, and that is known as hepatic encephalopathy. So now what can be the cause of this disease? Portal systemic hepatic encephalopathy in the patient having portal hypertension because of many causes, because of decreased blood resorption from circulation, or because of abnormal shunting of blood. It occurs most often the patient having cirrhosis, means liver is cirrhosed, and in acute hepatic failure patients hepatic encephalopathy occurs. So there are multiple causes of hepatic encephalopathy, like as I already mentioned, that cirrhosis or chronic parenchymal liver disease, chronic hepatitis, cirrhosis, fulminant hepatic failure, acute viral hepatitis. Drugs can also cause hepatic encephalopathy. Toxins like Wilson disease, in which copper is accumulated, and CCl4 can cause hepatic encephalopathy. And surgical causes of hepatic encephalopathy are surgical portal systemic anastomosis, in which port cable shunt or transjugular intrahepatic portal systemic shunt tips is applied. It can also lead to hepatic encephalopathy. Okay, so factors that precipitate hepatic encephalopathy are metabolic stress like injections, electrolyte imbalances, dehydration, renal failure, diuretic drugs, GI bleeding, high protein diet, and non-specific cerebral depressions, and like alcohol, sedatives, and analgesics can lead to hepatic encephalopathy. So in this way, hepatic encephalopathy patients in this way, hepatic encephalopathy is precipitated by these factors. Now, what happens in hepatic encephalopathy? There is increased nitrogen load because of constipation or because of any GIT bleeding causes excessive dietary intake of protein, or azotemia, means kidney involvement, can lead to hepatic encephalopathy. And infections, trauma, electrolyte imbalance like hypokalemia, alkalosis, hypoxia, and hyponatremia can lead to production of excessive ammonia, which goes to the brain, and it can cause hepatic encephalopathy. Drugs like diuretics and narcotics can also cause this condition. As you can see in this picture, there are different type of nutrients like excessive protein, alcohol, sedative, hypnotics. GI bleeding can cause hepatic encephalopathy, or surgical process like tips, jugular intrahepatic portosystemic shunt can lead to hepatic encephalopathy, or hepatocellular carcinoma can also give rise to this condition. So in this way, hepatic encephalopathy is precipitated. Now, the pathophysiology, as I already mentioned, that cirrhosis causes inflammation or bacterial translocation and vasoactive mediation. It leads to splanchnic peripheral vasodilation or hepatocytic dysfunction, and which in turn causes portosystemic shunt and increase ammonia blood level. And it in the end gives rise to the hepatic encephalopathy, in which brain edema occurs, astrocytic swelling, neurotransmitter receptor like GABA is increased, and it causes altered brain glucose metabolism, and hepatic encephalopathy is developed.